Shri Manjunathay Namaha. Good morning everyone and welcome to today's session on Sushruta Samhidadhyana. Without any delay, I would like to call upon Dr. Muralidhar Sharma sir, STMCA Udupi, to take over the session. Welcome to you, sir.
अथातो अनुवासन उत्तरबस्त चिकित्सितं व्याख्यास्यामहे धन्वन्तरिः. The next is about the Anuvasana Basti and Uttarabasti, more details about that. A bit of that introduction to the Basti was done in the previous chapters. Now you have more details about the protocols as well as the drugs which could be used in the combination of the preparation of the Basti. विरेचनात् सप्तरात्रे गते जातबलाय वै कृतान्नाय अनुमास्याय सम्यक् देयो अनुवासनः. Anuvasana Basti has to be given at least after 1 week after the Virechana, and once the patient has a normal activities after the Virechana, then it has to be given after the food. Anuvasana Basti has to be given only always after the food. यथा वयो निरोहाणां यामाप्राह पादावकृष्टाः कार्याः स्नेहबस्तिषु देहिनां. For the Snehbasti or Anuvasana Basti, the quantity of the drug given should be 1/4 of the Niruha Basti. The Niruha Basti is Radasha Prasata, so 4 Prasata. But most of the times what we do is not more than 40 ml. 20 to 40 ml is the usual quantity given for the Anuvasana Basti. उत्सृष्ट अनिल वेण्मूत्रे नरे बस्तिं विधापयेत् एतैः विहत स्नेहो नैवान्तप्रतिपद्यते. स्नेहबस्तिः विधेयस्तु न अविशुद्धस्य देहिनः स्नेहवीर्यं यथा दत्ते देहं च अनुविसर्पति. Now the Snehbasti or Anuvasana Basti has to be given only after the patient has passed the flatus, stools as well as urine. So once the bowels are evacuated, then the Basti has to be given. Of course it has to be given after the food. And because the fecal material, if it is left over in the bowel, then the Snehbasti quantity of the dravya given would not be reaching to the target area. And the Snehbasti videstu na vishuddhasya dehinah, it should always be given after shodhana, because Snehavirya, the pharmacological activity of the Sneha would not occur if the shodhana is not done prior to the Sneha. Prior to the Anuvasana. As a Uddham Prakshami Tailani Haitha Kramam, Pana, Anuvasana, Nasyeshu, Yani, Nihu Katan Bahun, the different yogas are mentioned, and these yogas can be practically done as such, and just casually read them. Shati Pushkara Krishnahva Madana Amaradharubhi Shataswa Kushtha Yastiyahva Vacha Bilva Hudasharihi Supishtahi Dvigunakshiram Tailam Tohe Chaturgadam Paktva Basta Vidhatuyam Mudhavatanulomanam Arsham Sigrahani Rosham Anaham Vishamajwaram Kati Guru Prishta Kostastan Vatavogamstana Shayeta. One of the yoga, that Shati Pushkara etc., they are prepared in the form of a Kshirapaka, and the Kshirapaka has, for the Kshirapaka, you add Taila, and this has to be processed properly, and it is used for anulomana of the vata, can be used in the diseases like Arshas, Grahani, and Vishamajwara, or the pain in the back area, Kati, Guru, Prishta, Kosta, etc. With Vacha, another of the yoga is Vacha Pushkara Kushtha Yela Madara Amara Sindhushaihi Kakoli Dve Eshyahva Meda Yugma Narathibihi Patha Jivaka Jivanti Bhangi Chandana Katpalehi Sarala Aguru Bilwa Ambu Vajigandha Agni Vruthibihi Viranga Arabhata Shama Trivarta Magadika Arthibihi Pistehi Tailam Pachet Kshira Pancham Mularasanvidam Gulma Anaha Agnishanga Arsho Grahani Mutrasanginam Anuvasana Vidhavu Yuktam Shasyate Anilogina. Another of the yoga which could be used for Gulma Anaha Agnimantya, Arshats Grahani etc., where you will be using more Kapagna Aushadis as such. Then one more level which will be improving that name would be where Ushnaviti Dravyas are predominantly used are Chitraka, Adivisha, Patha, Danti, Bilva Vacha, Amishehi, Sarala, Amshmati, Rasna, Nilini, Chaturangulaihi, Chavya, Ajamodaka, Kapoli, Meda Yugma Suratumehi, Jivaka, Rishabhaka, Varsha, Bhu, Bastagandha, Shanahwehi, Renu, Ashwagandha, Manjista, Shati, Pushkaradashkarehi, Sakshiram Vipachetelam, Arthamenashanam, गृध्रसी खंज कुब्ज आढ्यवात और आढ्य मूत्र उदावर्त रोगिणां शस्यते अल्पबलाग्नीनां वस्तौ आशु नियोजितम्. Another of the anuvasana basti yoga which could be used in the diseases like gridhrasi, khanjavata, etc. And can be used as such. ಭೂತಿಕ ಏರಂಡ ವರ್ಷಾಭೂ ರಾಸ್ನ ವೃಷಕ ರೋಹಿಷೈ ದಶಮೂಲ ಸಹ ಭಾರ್ಗಿ ಷಡ್ಗ್ರಂಥ ಅಮರದಾರುಭಿ ಬಲ ನಾಗಬಲ ಮೂರ್ವ ವಾಜಿಗಂಧ ಅಮೃತಾದ್ವೈ ಸಹಚರ ವಲಿ ವಿಶ್ವ ಕಾಕನಾಸ ವಿದಾರಿಭಿ ಯವಮಾಶ ಅತಸಿ ಕೋಲಕುಲಸ್ಥೈ ಕುತ್ಸ್ಥೈ ಶ್ರದಂ ಜೀವನೀಯ ಪ್ರತಿವಾಪಂ ತೈಲಂ ಶಿರಚತುರ್ಗುಣಂ ಜಂಘ ಊರುತ್ರಿಕ ಪಾರ್ಶ್ವ ಹಂಸ ಬಾಹುಮನ್ಯಾಶಿರಸ್ಥಿತಾನ್ ಹನ್ಯಾದ್ ವಾತವಿಕಾರಾಂಸ್ತು ಬಸ್ತಿ ಯುಗೈಹಿ ನಿಷೇವಿತಂ. Another of the yoga which is specifically used for the vata vyadhi involving the legs, jangha, or in the thighs, or in the buttock area, or in the scapular area, or in the shoulder, or maybe in the head. So vata vyadhi presenting with the pain in these areas can be treated with this basti yoga. जीवंती अतिबल मेधा काकोली वैदिवकैः ऋषभ अतिविष कृष्णा काकनासा वर्चामलैः रास्ना मदनैश्चाप सरला भीरुचन्दनैः स्वयं गुप्ता शटी शृंगी कलसी सारिवाग्वैः पिष्टैः तैलदसम्पक्वं क्षीरेण अष्टगुणेन च तच्च अनुवासने देयं शुक्र अग्निबलवर्धनं बृंहणं वातपित्तग्नं गुल्मानाहरं परं नस्ये पाने च संयुक्तं मूर्धजतुर्गदापहम्. Another of the yoga which can be used for gulma, etc. and balavardhana. It's a nourishing one and can be used for not only the anuvasana basti, can be given in the form of nasya as well as it can be consumed orally for all urdhvajatugata vyathi. मधुका उशीर काश्मीरिय कटुका उत्पल चंदनेहि श्यामा पद्मक जीमूत शक्रा अतिविषाम्भुभिः तैलपादं प्रत्येक्सर्भिः पयसा अष्टगुणेन च न्यग्रोधादि गणक्वाथ युक्तं प्रस्थिषु योजितं दाह असृग्धर बीसर्प वातशोणित बिद्रधीन् पित्तरक्त जराद्यांश हन्यात् पित्तकृतान् गधान्. In all the pittaja vyadhi, the yoga can be given where madhuka ushira etc. are used as such. So the importance anuvasana basti can be given with the various medications depending upon the clinical signs and symptoms of the disease. मृणाल उत्पल शालूक सारिवाद्वय केशरैः चंदनद्वय भूनिंब पद्मबीजकसेरुकैः पटोल कटुका रक्ता गुंद्र पर्पटवासकैः पिष्टैः तैलघृतं पक्वं तृणमूलरसेन च क्षीरद्विगुणसंयुक्तं बस्तिकर्मणि योजितं नस्ये अभ्यञ्जनपाने वाहन्यात् पित्तगतान् बहून्. Another of the yoga which can be used for pittaja vyadhi, and majority of these anuvasana basti yogas can be given in the form of nasya, abhyanga, or even the oral consumption also. So anuvasana basti is one of the most efficient method of this snehana. Another of the yoga is trifala, ativisha, murva, trivrta, chitraka vasakaihi, nimba, aragvada, षड्ग्रंथा, सप्तपर्णा निषाद्वयैः, गुडुचि, इंद्र, सुरा, कृष्ण कुष्ठ सर्षपनागरैः तैलं मेभिः समेपक्वं सुरसाद्रसाप्लुतं पान अभ्यञ्जन गण्डूषणस्य बस्तिषु योजितं स्थूलता आलस्य कण्वादीन् जयेत् कफकृतान् गदान्. Another of the kapahara yoga where you will be using the taila prepared with this, and it's also used for obesity, alasya, kandu, etc. सरल अगुरु कालिया भार्गी चव्य अमरद्रुमेः मरिचा येल अभय कट्वी षठी ग्रंथिक कट्पलैः तैलं एरण्डतैलं वा पक्वं येभिः समायुतं वल्ली कण्टकमूलाभ्यां क्वातेन द्विगुणेन च हन्याद् अनुवासने दत्तं सर्वान् कफकृतान् गदान्. In all the kaphaja vyadhi, the combinations of sarala guru etc. can be used. Vidanga udicya sindhutta षठी पुष्कर चित्रकैः खट्फल अतिविष भार्गी बचा पुष्टसुराह्वैः मेधा मदन यश्चाह्व श्यामा निचुलनागरैः शताह्व नीलिनी रास्ना कलसी वृषगरेणुभिः बिल्व अजमोद कृष्णाह्व बन्ती चव्यन नराधिपैः तैलं एरण्डतैलं वा मुष्ककादिरसाप्लुतं प्रीह उदावृत वातासृक गुल्म आनाह कपामयन् प्रमेह शर्करा अर्शांसि हन्यात् आशु अनुवासनैः which can be used in प्रीह उदावर्त रक्त वातरक्त Anaha, Gulma, etc. Even Prameha, the Yoga, Bara, Vidanga, the jets are given. Now, the important other these exceptions to the general rule are Ashuddhamapi Bhatena, Kevalena Atipeditam, Ahoratrasya Kaleshu, Sarveshveva Anuvasayeta. If the patient has a very severe Vata Vyadhi, you can give Anuvasanavasti even without the Shodhana. And it can be, though the general rule of the admission Anuvasana is it should be given in the daytime, but in a severe condition, it can be given at any time. Ahoratrasya Kaleshu. Any time it can be given. Anuvasana can be given any time if the patient has a very severe presentation. Otherwise, the general rule is it has to be given after food in the daytime and it should be given after the Shodhana. That is the general rule. But exceptions can be done based upon the conditions of the patient. Rukshasya Bahuvatasya Dvai Trin Api Anuvasana Dattva Snigdhatanam Japa Tadat Paschat Niruheta. In any patient who is very having severe Vata Vyadhi, Anuvasana Basti has to be given first, and once the Anuvasana Basti has shown that sign of Snigdhata, that's the Samyak Anuvasya Lakshana, then only Niruha has to be given. Niruha should not be started directly. That's the issue. All Niruha Basti should be this Matrantarita. It should be either Matra Basti or Anuvasana Basti, which has to be given in the form of covering, like so. It has to be given the Matra Anuvasana Basti in the beginning. Astigdhamapi Bhatena, Kevalena Atipidram, Sneha Pragadehi Matiman Niruha is Mupajareta. If the patient has very severe Vata Vyadhi, there could be exceptions to the rule. You may give a Niruha Basti directly, but that Niruha Basti should contain sufficient quantities of Sneha Dravya, oily substances should be there. Asa Samyak Nirudam cha Bhatadishu Anuvasayeta, Bilva Eshtya Madana Phalata Ileheta Karma. In after the Niruha Basti, again the Anuvasana Basti has to be given, and the Anuvasana Basti contents could be Bilva, Madhyasti or Madana Phala. Bilva for Vata, Madhyasti for Pitta, and Madana Phala for Kapha. These could be the options. Their Taila can be given as a Anuvasana after the Niruha Basti. Ratro Bastim Nadadyato, Dosha Utklesho hi Ratrijaha, Sneha Bhiri Kuriyad Admanam Garovam Jaram. The general rule is the Basti should not be given at night. And then exception I have already mentioned that. And if it is given at night, it can produce Dosha Utklesha and can produce distension of the abdomen or even Jwara. Temperature also may raise or even heaviness in the body. Ashni, Sthanasthite doshe Vannaucha Anna Rasanvite, Sputa Sroto Mukhe Dehe Snehoja Parisarpati. The Sneha or the oil contents of the Anuvasana Basti can spread into the body, throughout the body, if it is given in the daytime and when the patient has proper Agni and the Agni is also having contact with the food. So, Anna Rasanvite Agno. So, where there is the digestion process is going on during that time, because all the channels will be kept open and active, the Snehojaha, the that contents, pharmacological contents of the Sneha Dravya given in the form of Anuvasana spreads throughout the body. Pitte adhike kafe kshine rukshe vatarugardite nare ratrautu dartavyam karyecha usne Anuvasanam. Usne pittadike vapi diva daha devagadaha sambhavanti tasmat pradoshe yoje vishaka. The other exceptions to the rule is if the patient has a predominant pitta lakshana and kapha is very weak as such and the patient has a very dry body, Vyadhi, in such conditions the Anuvasana Basti can be given at night and in the warm seasons also, in the hot seasons also, it can be given at night. If the patient has a severe pitta and because in the daytime there would be burning sensation etc., in such conditions either it can be given in the early morning, pradosha is early morning, by the time the sunrise occurs, or at night it can be given. Shite vasante cha diva grishma pravd ghanate snehyo dinante panuktan doshan parijahishata. In the cold season or in Vasanta Ritu, it should be given, or if the daytime, during the daytime there is a lot of clouds as such, in such conditions it can be given at the evening hours. the panoktan doshan parijikshira, you have to avoid all the other problems related to the content in the stomach. You have to avoid consuming lot of liquids there, and snehanabasti can be given in the evening. So time for administration can be flexible depending upon the condition of the patient. Ahoratrasya kaleshu sarveshveva aniladikam tivrayam rujijirnannam bhujayitva anuvasayet. In a severe vatavyadi, it can be given at any time of the day throughout maybe 24 hours, any time it can be given. The only issue is the patient has to have some food in the stomach. If the patient has already digested the food earlier, you have to give some more fresh food and then give the anvasana. न च अभुक्तवद स्नेह प्रणिधे कथंचन शुद्धत्वात् शून्यकोष्ठस्य स्नेह ऊर्ध्वं समुत्पदेत. A sneha basti or anvasan basti should not be given in empty stomach condition, because in the empty stomach condition the basti dravya can reach to a level beyond the expected level. Proximally it may spread proximally. सदा अनुवासयेत्यापि बोधयित्वा आर्द्रपाणिनं ज्वरं विदग्धभुक्तस्य कुर्यात् स्नेहप्रयोजितः. न च अतिस्निग्धम् अशनं बोधयित्वा अनुवासयेत् मदं मूर्छां च जनयेत् द्विधा स्नेहप्रयोजितः. रुक्षं भुक्तवतो हि अन्नं बलं वर्णं च हापयेत् युक्तस्नेहम् असौ जन्तुं भोजयित्वा अनुवासयेत्. यूषक्षीररसै तस्मात् यथा व्याधिसमीक्ष्य च यथोचितान् पादहीनं भोजयित्वा अनुवासयेत्. Now, the general rule about the food prior to the anvasana is ideally anvasana has to be given immediately after the food. By the time the patient washes the hand after consumption of the food, before it dries, the anvasana has to be given. Ardrapani, that's when the hands are still wet after the consumption of the food, that's the optimum time. But in a patient of Jwara, and particularly if it is given later, and during the digestion, if the snehani basti, anvasan basti is given, it can result in jwara. Vidagdha jwaram kuryata. If the patient is having that digestion process, during the digestion process, if you have given anvasana, it can result in jwara. If the patient has consumed extremely oily food or some snigdha ahara, and in such conditions it should not be given, anvasana should not be given, because that sneha, oily substances given in both the ways, parectally as well as orally consumption of that oily substance can produce madam murcham janayate, can produce impaired consciousness. If the patient has taken extremely dry food, junk food, in such conditions if you give anvasana, it can produce deficit of the body strength. The balam varnanjapayat, vital functions could be affected if it is given after a dry food, and hence essentially it has to be given after some moderate sneha dravya. Then you may have to give the food depending upon the disease conditions. Considering that, you may prepare any of the food in the form of either yusha, kshira, rasa, etc. light food, liquid content, and the contents of the drug could be contents of the food could be depending upon the disease condition. And the only rule is it should not be given full stomach. There should be some amount of the empty space in the stomach. So there should be 1/4 of the stomach should be emptied before you give the anvasana. अथ अनुवास्यं सभ्यक्तम् उष्णाम्बु स्वेदितं शनैः भोजयित्वा यथा शास्त्रं कृतचङ्क्रमणं ततः विसृज्य चक्रन्मूत्रं योजयेत् स्नेहबस्तिना प्रणिधानविधानं तु निरूहे सम्प्रवक्ष्यति. For the anvasana, before the anvasana, the patient has to be given an abhyanga with the warm water, and svedana also has to be given. Then the food has to be given. Then the anvasana has to be given. After the anvasana, he has to walk a few steps as such. After the food, he has to walk a few steps, and then he has to evacuate the bowels and urine. Then the sneha basti has to be given. The tata pranihita sneha uttana vakshatam bhaveta prasarite sarvagatre tata viryam sarpati. So after the sneha basti is given, the patient has to sit erect for 100 matra kala. That's around 100 seconds. And because during that period, because sitting erect at that period will help in the spread of the oily virya, that sneha virya can spread into the body. Then ड्यूरिंग दिस पीरियड ताडे तलयोः एनं स्त्रीन् वारान् शनैः स्फिटोश्च एनं ततश्शय्यां 3 वारान् उत्क्षिपेत्ततः एवं प्रणीते वस्तु मन्दायासो अथ मन्दवाक स्वास्थ्येन शयने कामम् आसीत् आचारिके रतः. Then you may have to tap on the plantar and the palmar surface of the body or in the buttocks, tap thrice over these areas, and you may reach the buttock up and down for 3 times to facilitate the spread of the drug given, and this helps in keeping the patient in a better condition, and the patient should not exert much, should not speak much, and should lie down till he feels comfortable, and then after a certain period of time then he can start moving. सतु सैन्धवचूर्णेन शताह्वेन च योजितः देहः सुकोष्णश्च यथा निरेति सहसा सुखं यस्य अनुवासनो दत्तः सकृत् अन्वक्षम् आव्रजेत अतितैष्ण्यात् वा वायुना वा प्रपीडितः सवातो अधिकमात्रो वा गुरुत्वाद् वा सभेषजः तस्य अन्यो अल्पतरो देयो न हि स्निह्यति अतितिष्ठति विश्शब्द अनिलबिन्मूत्रः स्नेहहीनो अनुवासने दाहक्रम प्रवाहार्थी करश्चाति अनुवासनः. The anuvasana basti would contain saindava and shatapha, that's shatapushpa churna, which helps in the evacuation of the contents of the anuvasana with a short time. So, when it is given in warm, and anuvasana should have essentially saindava churna and shatapushpa churna, which help in facilitating the expulsion of the content. And after the anuvasana, patient has to be calm and should be moving around. And if the anuvasana basti has given in a very warm condition, very hot, then it can produce a pain in the body, or if it is adhirekshna, if it is tikshna also, it also can produce a discomfort to the body. And if it is pressed, like anuvasana basti is given very rigorously, then also it can involve the vata. Or if the medicines in the anuvasana basti, they are heavy, as they are very concentrated, then too it can produce the irritation. In these conditions, you have to give another smaller amount of the basti given, should be given as such. If the basti doesn't contain snehadravya, see in anuvasana basti, a snehadravya or oily substance should be always added. If it is not given, it can produce a obstruction to the passage of the vata and produce tiredness or pravahika, diarrhea-like conditions, or pain also can be produced. सानिलः सपुरीशश्च स्नेहः प्रत्येति यस्यतो वोषचोषो विना शीघ्रं सम्यक् अनुवासितः. Samyak anuvasana lakshana is the patient should pass the oil which is administered in along with the flatus and feces without any burning sensation and comfortably. Then it's a sign of samyak anuvasana. जीर्णान्नम अथ सायाह्ने स्नेहे प्रत्यागतं पुनः लब्धन्नं भोजयेत् कामं दीप्ताग्निस्तु नरो यदि प्रातः उष्णोदकं देयं धान्यनागरसाधितं तेनास्य दीपते वह्निः भक्ताकांक्षा च जायते. Once the patient has a proper digestion of the food after the anuvasana, that after the sneha has become evacuated, then you may give the laghu anna, light food has to be given if the patient has a proper digestive power. And then the next morning, you have to give warm water with dhanyaka and nagara, which also helps in the agni deepti. Sneha basti krameshevam vidhi mahu manishanaha. These are the procedures of protocols of the sneha basti. Anena vidhina shatva saptava astau navaiva vidheyaha baste tesham antaratu nirohanam. In this way, either 6, 7 or 8 or 9 bastis can be given, and tesham antara nirohanam. In between you may give niroha basti. This is what Sushruta has said. And according to Sushruta, there is, and of course, a similar theory is present in Charaka also. The sequentially given basti would help in different levels of functionality of the body. Dattastu prathamo basti hi snehe basti vangshanam. Samyak datto dvitiyastu mudhastham anilam jayet. जनेत् बलवर्णौ च तृतीयस्तु प्रयोजितः रसं चतुर्थो रक्तं तु पञ्चमः स्नेहे यत्तथा षष्ठस्तु स्नेहेत् मांसं मेधः सप्तमेव च अष्टमो नवमश्च अस्थिमज्जानं चेताक्रमम् एवं शुक्रगतान् दोषान् विगुणः साधु साधयेत्. So first basti given would be helping in snehana of the bladder and the scrotal area in the pelvic area. A second basti would be producing that vata shamana in the head area, and the third basti given increases the strength of the body and visual appearance also would be improving. Fourth basti given would be helping in improving the functions of the rasa. Fifth basti would be reaching to the rakta, and sixth basti would be reaching to mamsa, and medhas would be facilitated by seventh basti. Eighth and ninth would be helping in asti and majja, and if it is doubled, like instead of 9, if you give 18 bastis, it will help in removing the shukragata dosha. This is a unique concept of Sushruta. But practically, most of the times in the present clinical practice, we may not follow this protocol. Instead, we may follow the protocol mentioned in the later Samhitas. अष्टादशकान् बस्तीनां योनिषेवते यथोक्तेन विधानेन परिहारक्रमेण च सकुञ्जरबलो अश्वस्य जवैः तुल्यो अमरप्रभः बीजपाप्मा श्रुतधरः सहस्रायुः नरो भवेत्. So 18 bastis given would be facilitating that improvement of the shukra. If 18 courses of the 18 bastis are given, then such a person with all the parihara krama, the person would have a strength of an elephant, and he will have a speed of a horse, and he will be looking like the gods as such, and Shrutadharaha, he will remember anything which is just heard, and he will live for 1,000 years. This is what Sushru has said. Now, as far as the number of bastis given and the protocols, now practically most of the times what we follow is the Kala, Karma and Yoga basti mentioned in Vagbhata, as well as in the later books like Shargadhara and so on. And even Charaka Samhita also mentioned the similar protocol. Idanim Karma, Kala, Yoga Kyan basti visheshanaha प्राक् स्नेह एकः पंचान्ते द्वादश आस्थापनानि च सानुवासनानि कर्तव्यं बस्त्रयः त्रिंशत् ईरिताः. Now in Vagbhata, the numbers of basti could be modified into 3 categories. That's karma basti, kala basti and yoga basti. Karma basti is a presentation or a bunch of 30 bastis where you will be given, the patient has to have a sneha basti in the beginning and 5 these sneha bastis at the end. Dwadasha asthapana, 12 asthapana with the anuvasanas, and totally it becomes 30 of the course of the basti. That kind of a basti is considered as the karma basti. So first day sneha basti, then Dwadasha asthapana, 12 asthapanas with the matra basti or anuvasana basti in between. So 24 days, 25 days, 5 anuvasanas at the end. That becomes the karma basti. Then kala basti is kalaha panchadasha eko atra praksneho ante trayasthatha shat panchabastyantaritaha. In the kala basti there are 15 according to Vagbhata. In Sharnadara the kala basti would have 16 bastis. The sequence is slightly different. Initially it has to be one sneha basti, and then the panchadasha 15 niruha bastis, then 3 of the antya sneha bastis. So panchadasha shat panchabastyantaritaha, 6 of the niruha basti along with the niruha this anuvasana basti in between. So first is anuvasana basti, then the 6 niruha bastis along with the anuvasana in between, so 12 days, and then the 3 days of sneha basti to be given. That's the kala basti according to Vagbhata. In Sharngadhara that whole sequence is slightly modified in such a way that it comes to 16 days. But most of the times what we practically give in the routine clinical practice is yoga basti, because the duration would be shorter, and that's yoga astau bastayah. Atra tu trayo niruhaha snehascha sneho adyantayoho ubhau. The 8 bastis are the usual combinations of the yoga basti, which is most of the times in majority of the patients what we give is the yoga basti, where you will have trayo niruhaha snehashta sneho adyantayoho ubho. So 3 niruhas along with the sneha basti in between. The first and the last would be again sneha basti. So first day sneha basti, second day again sneha basti, third day niruha basti, and then again sneha niruha this way, and then again the last would be sneha basti. This makes 8. But the same can be also modified. Now we do these kinds of modification many times. Instead of this, we may start with 3 niruha bastis, 3 matra bastis or anuvasana basti, then 3 niruha bastis, then 1 more or 2 more the sneha bastis can be given. This also can be another of the options of sequence which can be modified according to the condition of the patient. And most of the patients in the routine clinical practice, we prefer the yoga basti, which is involves a duration of 1 week. स्नेहबस्ति निरूहं वा नैकम् एव अतिशीलयत् स्नेहात् अग्निवध उत्क्लेशो निरूहात् पवनाद्भयं तस्मात् निरूढो अनुवास्यो निरूहश्च अनुवासितः एवं नैवं पित्तकफोत्क्लेशो स्यातां न पवनाद्भयं. You should not prescribe only Snehabasti or only Niruhabasti in any of the patient, because only Niruhabasti given could be impairing the Agni functions, whereas if it's only Niruhabasti there could be Vata Prakopa, and hence there should be a combination of Niruhabasti and Anuvasanabasti in all the conditions, and this ratio of the combinations and the number of these bastis can be modified according to the condition of the patient. रुक्षाय बहुवाताय स्नेहवस्तिं दिने दिने तद्याग वैद्यः ततो अन्येषाम् अग्नि आबाधभयात्र्यः. The patient is very ruksha and severe vata vyadhi, then a continuous snehvasti can be given, then the niruhavasti can be started. Otherwise, in general, the rule is 3 snehvastis followed by the niruhavasti is the general rule. स्नेहो अल्पमात्रो रुक्षाणां दीर्घकालम् अनत्ययः तथा निरूह स्निग्धानाम् अल्पमात्र प्रशस्यते. If the patient is very ruksha, then a snehvasti can be given for a long duration in smaller quantities. In smaller quantities, it can be given for a longer duration if the patient has a severe vata vyadhi. Similarly, if the patient has a severe snigdhata, a niruhavasti can be given for a longer duration beyond these rules, if necessary in smaller quantities. अत ऊर्ध्वं प्रक्ष्यामि व्यापद स्नेहबस्तिजाः बलवन्तो यदा दोषाः कोष्ठे स्युः अनिलादयः अल्पवीर्यं यदा स्नेहम् अभिभूय पृथग्विधान् कुर्वन्ति उपद्रवान् स्नेहः स चापि न निवर्तते. तत्र वाताभिभूते तु स्नेहे मुखकषायता जृम्भा वातरुजस्तास्ताः वेपतुः विषमज्वरः पित्ताभिभूते स्नेहे तु मुखस्य कटुता भवेत् दाहः तृष्णा ज्वरः स्वेदो नेत्रमूत्राङ्गपीतृता श्लेष्माभिभूते स्नेहे तु प्रसेको मधुरास्यता गौरवं छद्दिरुच्छ्वासः कृच्छ्रात् शीतज्वरो अरुचिः. One of the complications of the snehbasti is if the patient has the excess of doshas, that's if the shodhana is not done and the snehbasti is given. In such conditions, the doshas may overtake the sneha and they produce the complications. Now, if there is a vataja complication produced with sneha, the patient may have a bitter taste in the mouth, yawning, and the different types of the vataja vyadhi can occur, or vishamajvara also could be produced. In case of pittaja lakshanas, pitta abhibhuta sneha lakshanas, there will be pungent taste in the mouth, burning sensation, excess of thirst, even fever can also occur, and yellowish discoloration of the eyes could also occur. If there is a kapha involvement, then there will be excess of salivation, sweetish taste in the mouth, heaviness, even vomiting. These are shitajvaraha, that's fever can occur without really the temperature. Now, practically, we will see these kinds of any of these kinds of complications in the patients where snehbasti is given in a large number of patients, and because in majority of the patients, when we give it in the ward, we may not follow the shodhana. But most of these complications can be managed with the other medicines which we are given. So most of the times when we practically administer the patients in these bastis, we will be continuing with the Shamana Aushadhis, and these Shamana Aushadhis will take care of these possible complications produced due to the involvement of the doshas. तत्र दोषाभिभूते स्नेहे बस्तिं निधापयेत् यथात्वं दोषशमनानि उपयोज्यानि आर्जा. If there is a dosha lakshanas, what Sushruta suggests is the same. You have to administer such shaman yogas which can reduce the dosha lakshanas. So, in the routine general practice, we do give some medicines. Along with that, the basti is given, and that takes care of that kind of a final complications. अत्याश्रिते अन्नाभिभवात् स्नेहो नैति यदा तदा गुरुः आमाशयः शूलं वायोश्च अप्रतिसञ्चरः हृत्पीडा मुखवेगस्यं श्वासौ मूर्छा भ्रमो अरुचिः तत्र अपदर्पणस्य अन्ते दीपनो विधिः इष्यते. Now, if the patient has given excess of food, more food before the sneha basti, that results in heaviness of the abdomen, and there could be a pain produced due to improper movement of the vata, chest pain, mukhavedasya, dyspepsia can occur, or breath resistance also can occur. In such conditions, apadarpana has to be done, should not be given another food, or some deepana ahara should be given. Ashuddhasya मलोन्मिश्रः स्नेहो नैति यदा पुनः तदा अंगसदनात्मने श्वासशूलं च जायते पक्वाशय गुरुत्वं च तत्र द्वित्यात्निरोहणं तीक्ष्णौषधीः एव सिद्धं चापि अनुवासनं शुद्धस्य दूरानुसृते न if the ashuddhasya, if the patient is not given shodhana before the sneha anuvasana basti, due to the mix up of the sneha dravya with the feces, it may get retained, this dravya, the basti dravya may get retained, which may produce a discomfort throughout the body, distension of the abdomen, breathlessness, or even the pain, or heaviness in the abdomen also can occur. In such conditions, niruha basti is the remedy. If there is a tikshna aushadhi, very powerful drug is given, तीक्ष्णं तीक्ष्णौषधीः एवं सिद्धं चाप्यनुवासनं शुद्धस्य दूरानुस्तुते स्नेहे स्नेहस्य दर्शनं गात्रेषु सर्वेन्द्रियाणाम् उपलेपा अवसादनं स्नेहगन्धिसुखं वापि सुखं मुखं चापि कासश्वासावरोचकः अतिपीडितवत् तत्र सिद्धि आस्थापनं तथा. Now, of course, the other option in case of the sneha dravya not coming out would be some tikshna dravya has to be given in the form of anuvasana. If the patient is given shodhana, after the shodhana, when the sneha basti is given, if it reaches beyond the expected area, more proximally, in such conditions the patient may have a feeling of oiliness throughout the body and a dullness, or even the smell of the sneha dravya could be felt in the mouth, breathlessness could occur. In such conditions, another asthapana has to be given to the patient. अस्विन्नस्य अविशुद्धस्य स्नेहो अल्पः संप्रयोजितः शीतो मृदुश्च नाभ्येति ततो मन्दं प्रवाहते विबन्ध गौरव आत्मानशूलाः पक्वाशयं प्रति तत्र आस्थापनमेमाशु प्रयोज्यं सानुवासनम्. If the patient is not given swedana or the shodhana is not done and the quantity of the sneha dravya is less than optimum, in that condition it may remain in the abdomen and may leak out slowly, drop by drop, like continue for that leakage of the substances for long duration, or even distension of the abdomen can occur. In such conditions, another asthapana has to be given. Alpam bhuktavato alpo hi snehah mandagunastata datto naitiklam utkleshu brisham cha aratim avahet tatrapi asthapanam karyam shodhaniyena bastina anvasanam cha snehena shodhaniyena shasyale. If the patient is given less than optimum food and the quantity of the sneha dravya also is lesser, then it may not reach to the optimum area and it may produce a discomfort in the abdomen, general debility, or in such conditions also another asthapana has to be given or another anuvasana with the shodhaniya dravyas. अहोरात्रादपि स्नेहः प्रत्यागच्छन्नपि न दुष्यति कुर्यात् बस्तिगुणाश्चापि जीर्णस्तु अल्पगुणो भवेत्. If the sneha dravya doesn't come out even for a day, still it may not produce a severe discomfort or damage to the body. It may still have its own effects. So that duration, time taken for the expulsion of the contents is not an important issue. It may take longer time, but it should not be expelled immediately. यस्य नोपद्रवं कुर्यात् स्नेहबस्ति अनिश्चितः सर्वो अल्पो वा आवृतो रोक्षात् उपेक्षितः विजानता. If the sneha dravya given doesn't come out, then you can just neglect it, because It may not produce any serious discomfort. Anayantam tu ahoratram sneham samshodhane haret. Still, you may give a shodhana basti in such patients if it doesn't come out even after a day after the administration of the sneha. Sneha basta ananyate nanya sneha vidyate. You are not supposed to give another sneha basti till the previous sneha basti has come out. Iktyuktaha vyapada sarvaha salakshana chikitsadaha. These are the different complications as such. The next part is about uttarabasti. बस्तेः उत्तरसंज्ञस्य विधिं वक्ष्याम्यतः परं चतुर्दशाङ्गुलं नेत्रम् आतुराङ्गुलसंमितं मालती पुष्पवृन्दाग्रं छिद्रं सर्षपनिगमम्. Uttarabasti is the next issue, and the Uttarabasti, the tube, it should be 14 angulas, and the tip of the tube should be as thick as that of the anguli of the patient, and the tip should be pointed. Malati Vrita Pushpagram, the lumen of the tube should be as anguli, and it should be having a pointed tip, which is the pointed tip is as thin as sarshapa. A small, very fine tipped instrument tube has to be used. Sneha pramanam paramam prakunjashchatra kirtidha panchavinshad adho matram vidadyad buddhikalpitam. The maximum quantity of the snehatravya in Uttarabasti is 1 prakunja. That is one amount of the fluid which can be retained in a hand, as such folded hand. In an adult, it is not more than 100 ml. And if it is more than 25 years, then you may just modify the doses according to your intelligence or your experience. निविष्ट कर्णिकं मध्ये नारीणां चतुरङ्गुले मूत्रस्रोतपरिणाः मुद्गवाहितशाङ्गुलं मेढ्रायामसमं केचित् इच्छन्ति खलु तद्विदः. For the females, there should be karnika in the middle of the tube and at the 4th angular level, and the diameter would be mutrasrotaparinaham, as thick as that of the urethra. So female's tube is wider and male's tube is narrower, thinner as such, and that's the reason is it can be easily pushed in the female urethra. तासाम् अपत्य मार्गे तु निदध्यात् चतुरङ्गुलं व्यङ्गुलं मूत्रमार्गे तु कन्यानां तु एकमङ्गुलं विधेयं चाङ्गुलं तासां विधिवत् वक्ष्यते तथा. In the females, the Uttarabasti can be of 2 categories. It can be either given into the bladder or given into the uterus. When it is to be given into the uterus, then the maximum penetration would not be more than 4 angulas, and if it is for the urethra, it should be about 2 angulas. In Kanyana, in the very young age, where the uterus is not fully developed, it should not be more than 1 angula. And to prevent a over penetration, that karnikas, that obstructing structures, should be kept at different levels. Snehasya prasutam chatra swanguli mula sammitam deyam pramanam param arvat buddhi vikalpitam. The quantity of the sneha in case of Uttarabasti given into the uterus would be prasuta. That's a amount of the dravya which can be held in extended palm, not flexed palm. Prakunja is a flexed palm where the quantity would be more, and in the extended palm it would be around 30 ml. Average it would be 30 ml or less than that, depending upon the age of the patient. औरब्रह शौकरो वापि बस्ति राजश्च पूजितः तदलाभे प्रयुञ्जितः गलचर्मतु पक्षिणां तस्य अलाभे धृतेः पादो मृदुचर्मतौ वा. The pushing structure, that balloon-like structure which is connected to the tube, would be of a bladder of sheep, or maybe the shaukarah is bowl as such, or bastirajash. It could be of some birds also, or the neck of the birds also could be used for that, because the quantity is smaller. The quantity is smaller and the size of the bag also is smaller. अथ आतुरम् उपस्निग्धं सुन्नं प्रशिथिलाशयं यवागुं सघृतक्षीरं पीतवन्तं यथाबलं निषण्णम् आजानुसमे पीठे सोपाश्रये समं स्वभ्यक्तबस्तिमूर्धानं तैलेन उष्णेन मानवं ततः संस्थापयित्वा नालम् अस्य प्रहर्षितम् एवं शलाकया अन्विष्य ततो नेत्रम् अनन्तरं शनैः शनैः कृताभ्यक्तं विदध्याल आलानि षट् मेढ्रायामसमं केचित् इच्छन्ति प्रणिधानकं ततो अवपीडयेत् बस्तिं शनैः नेत्रं च निर्हरेत् ततः प्रत्यागतस्नेहम् अपराह्ने विचक्षणः भोजयेत् पैसामात्रां विषेण अथ रसेन च अनेन विधिना दद्यात् बस्तीन् त्रीन् चतुरोऽपि च. The protocol of administering the Uttarabasti, Susha has mentioned mainly it's in the males now. That protocol we mentioned is here in the males. In the females, it has to be modified according to the convenience. In the males, the patient has to sit in a knee-height seat, and before that, the patient has to be given abhyanga over the basti and murtha, over the head and the pelvic area. The abhyanga has to be done. Then the tube has to be inserted in an erect penis situation, and it should be pushed till it reaches to the level of the bladder, and then it should be pushed very slowly, and once it reaches to the level of the bladder, the drug has to be pushed in. Tato operated bastim, it has to be pushed in, then the tube has to be removed. Then wait till that oily substance or the drug which is given would be expelled out, and it should not be more than half of the day. So if it is given in the morning before noon, that should be brought out. Then you have to give a food with the milk or some liquid contents, yusha or rasa has to be given, and the total number of basti could be 3 or 4 bastis can be given. ऊर्ध्वजान्मे स्त्री दद्यात् उत्तानैः विचाक्षणः सम्यक् प्रपीडयेत् योनिं दद्यात् समुत्पीडितं त्रिकर्णिकेन नेत्रेण दद्यात् योनिमुखं प्रति. For a female, the patient has to lie down in a lithotomy position, and in the lithotomy position you have to insert the tube and then give the drug. Garbhashaya vishuddhyartam snehena dviguneena tu. If it is for the clearance of garbhashaya, the quantity of the sneha dravya could be double. Of course, it's quite difficult to give that kind of a quantity, double the quantity in a uterus, whereas in the bladder it could be given directly. Katak pramanam prasutam sriyam viprasutam bhavet kanyatarasyaha kanyayah tadvad basti pramanakam. The Katak pramana for the females is prasuta, one prasuta, that's extended hand contents, that's around 30 to 40 ml. Or in an adult it could be viprasuta 80 ml. कन्यायाः तद्वत् बस्ति प्रमाणकं. The kanya for virgin, it should be lesser than that. The quantity would be as in case of the Uttarabasti. Now the issue is, the practical problem is, I don't know, the confusion issue is when Sushruta says a Garbhashaya Basti, whether it is really into the uterus or whether it is into the vagina. When you look at the quantity suggested by Sushruta, it looks like the drug is given into the vagina, not into the uterus. But if you look at the description of the tube, which is having a sarshapa matra, the thickness of the sarshapa, it could be into the uterus. But most of the time, and practically, you cannot just directly insert the tube into the uterus without dilatation. So if at all you have to give the drug into the uterus, a protocol of dilatation is necessary, and only after the dilatation you can insert the tube. These are practical issues, and practically whenever the Uttarabasti is given into the uterus now, that dilatation is done as a essential feature, and the quantity cannot be as mentioned by Sushruta like true prasuta. True prasuta cannot be given into the uterus in the normal situation, because the total volume of the uterine cavity is not more than 20 ml. That's the real issue. So you need to modify, and there are certain grey areas in the description mentioned in Sushruta. अप्रत्यागच्छति बिशक् बस्तौ उत्तरसन्निधे भूयो बस्तिं निदध्यात्तो संयुक्तं शोधनैः गणैः गुदे वर्तिं निदध्यात्वा शोधनद्रव्यसंवृतां प्रवेशयद्वा मतिमान् बस्तिद्वारम् अथ एषणे पीडयद्वापि अधो नाभेः बलेन उत्तरमुष्टिना आरग्बुधस्य पत्रेस्तु निर्गुण्ड्याः स्वरसेन च कुर्यात् गोमूत्रपिष्टेषु वर्तीः वापि ससैन्धवाः मुद्गा येलसर्षपसमाः प्रविभज्य वयांसितो बस्तेः आगमनार्थाय तथा निदध्यात् शलाकया आगारधूमबृहती पिप्पदी फलसैन्धवैः कृता वा शुक्तगोमूत्रसुरापिष्टैः सनाकरैः अनुवासनसिद्धिं च वीक्ष्य कर्म प्रेरयेत. The drug which is given in the form of Uttarabasti should be expelled out. If it doesn't get expelled out, then you may stimulate that expulsion by different methods. And the suggested methods are either it could be suppository into the anus with the Shodhana Dravya, or you may put in a probe or a rod through the urethra and then stimulate that, or you may compress the pelvic area, the suprapubic area with your hands, or you may administer the drugs like Aragota Patra Swarasa, Nirgundi Swarasa, or any other Tikshna Dravya can be given which can be stimulating the expulsion. शर्करा मधुमिश्रेण शीतेन मधुकाम्बना दक्षिमाने तदा बस्तौ दद्यात् बस्तिं विचक्षणः क्षीरवृक्षकषायेण पयसा शीतलेन च. After the expulsion, the patient has to be given a basti, the anuvasana basti, with the kshiravruksha or shita milk, cold milk as such. Shukram dustam shonitam jangananam pushpodrekam tasya nasham cha kastam mutraghata mutradoshan pravardhan yoni vyadhim samsitim cha aparayah शुक्रोत्सेकम शर्कराम अश्मदीं च शूलं बस्तौ वंशने मेहने च घोरान् अन्यान् बस्तिदांश्चापि रोगान् हित्वा मेहान् उत्तरोहन्ति बस्तिः. उत्तरबस्ति is given in शुक्रदृष्टि, रक्तदृष्टि, or abnormalities related to the menstruation, or mutraghata, mutradosha, or in any of the yoni vyadi, patients having abnormalities of the discharges of the semen, or in case of the pelvic pain conditions, uttarabasti can be given. सम्यक दत्त सिलिंगानि व्यापक क्रमेव च बस्ते उत्तर संन्यास्य समानं स्नेह बस्तिना. The सम्यक दत्त बस्ति लक्षण or the व्यापक are as in case of the स्नेह बस्ति. With this we will conclude this chapter. सुश्रुत संहिता चिकित्सा स्थाने अनुवासर उत्तर बस्ति चिकित्सितं नाम 37 If there are any questions, we will try to answer, and then right, there are no more questions, so we will wind up. We will continue in the next session.